Hey everyone, Dr. Eric Jackson here at the Illinois State Dental Society Mission of Mercy. We're here in Collinsville, Illinois, the 2016 location. Let me take you on a little tour. It's been really busy. This is day one, Friday, the 15th of July here. Behind me we have medical triage. Patients arrive. We've had patients literally camped out, sleeping in tents for multiple days, I've heard, actually, in order to get in. Hundreds of people, and they just keep coming through the door. Medical triage is their first stop. We make sure that they get checked out medically, medical histories, all the normal stuff that you would as a patient. Excuse me. Then they go for dental triage. Dental triage, obviously, you've got to figure out what's wrong, what the main issue is. At minimum, everyone gets one thing done, of course, logically, but and many people need more than that. So we're trying to do as much as we can to as many people in as short a time as possible. It's run very much like a MASH unit, or a hospital, if you will. There's administrative type procedures, then there's check-in, like triage, and then they go through x-ray. You can see behind me there's x-ray. We've got ourselves then a waiting room here, just like everybody else. Let me show you here. In every other office in America has got a waiting room. Well, we have one, but it's hundreds and hundreds of chairs. And then we get down to, we got cleanings. We've got people, let me take you on a little tour here. We've got hygienists doing cleanings. Tons and tons of cleanings being done. We continue on, we've got pediatrics. A pediatrics area, so that way young children, special needs children can all be taken care of as well. Everything is done on a massive scale. So this is essentially a giant office. All the same standards, all the cleanliness, all the sterilization units are all the same. They have to make sure that. So they've got all the different sterilization here. The Mission of Mercy, they got the clean instruments, the dirty instruments. You can bring your own instruments if you wish, but they all got to go through the multiple cleaners in the back there, the sterilization units. Then we've got over here to fillings and the root canals. So we've got the ability for root canals to be done. I'm working fillings today. We've got over 30 doctors doing just fillings alone. And believe me, we've already seen dozens of patients, and it's, I don't even know what time it is. Maybe 10 o'clock already. We all reported here around 4:30, 5 o'clock for orientation, and doors open shortly thereafter. As you can see, we keep going here. Central supply, dentistry involves a tremendous amount of small little disposable stuff, gauze and little wedges and all the things that you find at the dental office. Fortunately, there's a lot of great sponsors who've donated a ton of these things to us. Finally, we come down the other end of the long hallway here, and we've got more fillings as well as extractions. There's minor laboratory repairs on things like dentures. So if you've got a chipped denture tooth, you can get that fixed on site, which is fantastic. Things that we can't do, crowns, things that we can't do, making new dentures, things like that, bridges, those all involve a lot more time, as well as off-site dental laboratories. But ultimately, pretty much what you've seen here is just a tremendous mobilization of dental effort. The sponsors are invaluable. The organizers are invaluable. We've even got a little pharmacy here for people after they get their oral surgery done. They can walk out with that painkiller or antibiotic if they need it. So for me, the big thing, making sure that everyone's taken care of. So that's pretty much it in a nutshell. Oh, and then over here, this is exit interviews. Obviously, it's important. We want to know what we can do better. We want to know how they were served. And these wonderful volunteers here sit down and ask a few pertinent questions. They actually have goodie bags just like you would in another office. So in general, that's the gist of the entire organization here. Thanks for taking a little walk with me. Hope you enjoyed the video, and we'll see you at the next, I guess it'll be 2018 Mission of Mercy. They hold these every 2 years. So 2018 Mission of Mercy will be around the corner and here before you know it, I'm sure. I'll see you then. Take care. Bye.